researcher, I dream not needing to do this work anymore by 2040. You may wonder how this could be possible, because by then, I envision a world where each year, millions of children no longer be threatened by malaria. And that is the vision behind a project I'm proud to be part of and excited to tell you about today. OPT-SMC, standing for Optimizing Seasonal Malaria Chemoprevention. Would you like to know how this project came about? OPT-SMC was a response to an urgent need of universal access to core malaria interventions and aiming at full coverage. And focusing on one intervention, SMC, the project was built in three principles. Firstly, there is no one global solution for poor coverage. Barriers differ by context, and implementation research is needed in each SMC country. Secondly, research findings are more likely to be implemented when the national programs are involved. And thirdly, it is important that lessons are shared across countries. So therefore, thanks to the European and developing countries' clinical trial partnership, OPT-SMC was set up as a partnership with the 13 national malaria programs that are implementing SMC. And it is coordinated by Professor Jean-Louis Ndiaye at the University of Chess, with the technical support from London School of Hygiene and Tropical Medicine, and our two hosts today, TDR and MMV. The objective was to support technically and financially the national program to identify SMC research priority questions, lead implementation research, and then put findings into practice. So despite challenges in coordination, OPT-SMC has achieved impressive results in 4 years, helping countries to either monitor and evaluate, explore barriers, implement adapted strategies to overcome these barriers or to adapt target groups. And as examples, our colleagues from Ghana has assessed during the COVID-19 pandemics, SMC coverage and factors that are associated with uptake and adherence. We also have our colleagues in Nigeria who conducted qualitative study across 5 states to understand community attitudes and barriers. Guinea and Burkina Faso also explored barriers, focusing respectively on mining zone and urban area where coverage were reported to be low, and they are now working all together with stakeholders to pilot adapted strategies. We also have Cameroon and Mali who have explored how they could improve adherence to second and third dose of amodiaquine. And all these experiences have revealed critical insights, notably addressing mistrust and concern about safety, involving local advocates, and recruiting local distributors are among key to success. Now we are entering a new phase of malaria prevention with the malaria vaccines. But for me, the question remains, how to achieve high coverage? Malaria vaccines are likely to face same challenges as SMC, and I'm convinced that the approach of OPT-SMC is one that could be considered to support the implementation research that will be needed. And hopefully, we will soon have exciting announcement along this line with a new project to support country optimize the vaccine delivery. Today, I want us to remember that the fight against malaria is evolving. But with the combination of right tools, with research, capacity building, and global collaboration, we can envision a world where millions of children, where malaria is no more a leading cause of child mortality. Please, let us seize this moment and push forward to our shared mission to save lives, eliminate malaria, and so I can realize my dream and start a new job career within the next decade. Thank you.